Symptoms that women and people have in that first trimester are utter shite. But what can you do to help with all the symptoms that you have when you're growing your tiny human being in your uterus? And what helped you in that first trimester of your pregnancy with all the symptoms that you had? What top tips would you give to other mums and parents to be? So let's start with breast tenderness. This is often one of the very first signs that women and people know that they are pregnant, because suddenly they feel like their boobs are increasing in size, they're suddenly a lot more tender and sensitive. So one of the first things that you can do that will help is to get rid of any underwired bras and to wear non-wired bras. Make sure that they fit correctly as well. You can always go and get your breasts measured somewhere. Loose-fitting cotton clothing can also be really beneficial for that boob tenderness. I mentioned in video 1 that it's partly to do with your progesterone that causes all of the blood pressure changes, opening up your blood vessels. It's called vasodilation, so it opens up all the blood vessels because of the progesterone effect. And so things that will really help maintain your blood pressure include remaining hydrated in your pregnancy. So drinking little and often, but also think about eating little and often as well. And do not feel guilty if all you can eat and all you can tolerate is bland, plain foods. If it's salty and plain and you're managing to keep it down, do not feel guilty about the nutrition that you take in your body. Whatever you can keep in is a great win. Eating little and often will help to maintain your blood sugars at a pretty relative constant state, so that you're not having huge increases in your blood sugars that can then lead to huge crashes which make you feel more nauseous and sick. So having biscuits by your bed, for example, so before you even get out of bed in the morning, having a nibble on a biscuit may help to reduce the nausea symptoms, for example, and eating little and often will also really help. Really important that you tell your employers so that you can have regular breaks as well. Being regularly hydrated and eating little and often will also help with preventing any headaches or migraines that you might have as well. Ligamental pain can also be really common in that first trimester, and that's where all your ligaments are softening in response to the hormones. Really important that you always get any abdominal pain checked out. So calling 111 or your community midwife or your GP for an assessment, very important, because sometimes human baby beans can implant where they're not supposed to be, either in previous cesarean birth scars, for example, or alternatively in fallopian tubes or anywhere else. So always worth getting any pain that you have in that first trimester abdominally, getting it checked out. For ligamental pain, discuss with your midwife or refer to a physiotherapist for some gentle exercises, and warm compresses can also help at this stage. Tiredness is very common, so having regular siestas and little rest breaks where you can, and putting your feet up wherever it's possible. I know that's easier said than done when you've got other children and work to balance, but wherever possible, try and ensure that you are getting regular points where you can have a nap or rest. And in relation to food, aversions to certain smells and tastes can increase. This is your body protecting your baby against anything that might cause harm to you or your baby in this pregnancy. So having those bland, plain foods are sometimes the body's way of saying, if we repel and we are repulsive to certain smells and certain really strong fragrances, we keep this baby safer. So there is a reason why in the first trimester, most women and people will be very sensitive to certain smells and perfumes and cookery foods as well. There will be time for proper nutrition later on in your pregnancy, and this is where taking sprays or tablets of folic acid and also vitamin D will help with the pregnancy in that really early stage, until you're able to really increase your nutrition if you're unable to tolerate anything than bland, plain, salty foods. There are some complementary therapies that can help in that first trimester. For example, acupressure, acupins can be really beneficial for sickness, as can acupressure bands. That can really help with nausea and vomiting in pregnancy. And there is some evidence on things like ginger and peppermint, which can also help with nausea and vomiting. These are the research studies, but for some women and people, ginger and peppermint become a real aversion during pregnancy. So it's all about what's right for that individual person. Whilst growing your tiny human being is so incredibly challenging, I promise you it will be worth it in the end. And for most women and people, those symptoms do start to ease around that sort of 12 to 16 week mark, but there are often other symptoms that take over at that stage.